Bismillah ar-Rahman ar-Rahim. My name is Dr. Muhammad Mirza, Consultant General Surgery. I am academic staff in Department of Surgery, Medical College of Al-Qura University in Mecca. We are going to learn some types of noting techniques here to use it in your surgical practice. Now I will show you how to do two-hand noting. So, holding the tie, and my aim is to come into this position. So to come to this position, what I do, I hold it by my all fingers, and my two thumbs are free here. And now my left hand is coming towards the right from the back of this limb, and it goes in between. So now I reach to the point which I want, and bringing this by holding the tie, the thread, and bring it to the other side. So I got one knot which rests on this way. Again, now what I do, I have to lock this one. To lock it, I have to do the reverse of this knot. So my hand now, instead of coming from behind, it comes from front of the limb of this thread, and the right hand now comes to the left side. Now again, I reach to my aim, which is the crossing of two limbs, and my two fingers will go to bring the thread, which makes again the tie, the knot. So it rests over the first one. Now we do one hand technique. One hand technique, we hold the two threads, the right hand in front, the left on the back. We hold it like, now the difference here that I am holding it with the index and thumb, and the rest of three fingers are free. The left hand comes from the front of the same limb of the thread, and the right hand brings the other limb to make again the crossing which we need, and this limb should go through the crossing. How to bring it? Just by holding it by these two fingers and bring it in. And now as you see here, it rests very easily. The locking of this one will be with the other hand. It comes again from the front, and the other hand, the left hand, brings the limb here, and again, as you see here, the crossing. So I have to bring this limb through the knot, and as you see here, the end of my knotting, it locked over the first one. The main thing here is not to bring, if I do the locking with the other hand, what happens is it comes this way. This is wrong because there is some rotation here. Later on, this one will be rotated and the knot will be very loose here. So when I bring it, I have to bring it in right way. Means it should rest directly over the first knot, as you see here, not with a rotation. So now I am doing the locking of this first knot, holding the limb which I work on by my middle and thumb. The index comes from behind and rests over the other limb. So again, the crossing here, as you see, and I have to bring this limb through this opening. How I bring it, as we described previously, we bring it using this index and bring it through the opening out. Now I have to hold it, so I use my middle finger, and it should rest over it. Again, to show you, you see, middle and thumb, the index comes crossing here, bring the thread through, and again locking. Lastly, I will show you. You see, very easy. Just bring it outside. Okay. Now, knot, we call it surgical knot. Surgical knot is double knot. It is composed of two knots, as we described in two-hand technique. When we do it, you see, this is first knot, and we bring it back. So we will have, as you see here, two knots. It gives you more secure holding of the tissue. Now, to make it easier for us and faster and better, we can do it at once. So we do by one hand the first technique of one hand technique, and as you see here, and you know how to do it, and the other hand will do the second technique of one hand. It is, you see, as you see here, it is ready to bring. So just I will take it by my index finger and bring this, which I did it before. So as you see here, we have two knots in this tie, which will rest over and secure the area. The next one will be a simple to lock it, a simple knot over it to lock the first one. I will show it to you again to see it again. So as you see, holding it, you see, this is the first one comes, and this is the second one comes in. It will be faster and easier to do in closed spaces and to save your time. Let us see how to do the knot using the instrument. Take my stitch. What I do, I take the limb where the needle is located, okay, and my needle holder. I can use also whatever, like arteries, for example, and make two loops around the needle holder. You see again, from inside. This is the free limb. We have to make it short. Okay, you see, 1 and 2, and now just I will hold the tip of the knot and bring the other limb out from the needle holder, and as you see, we have a surgical knot here. The next one is to make another loop, only one loop over the first one, so it will lock my surgical knot. It is fast, very easy to do, and it is also you can use a very short thread. If you have no thread or you have shortage, you can use this one to save your threads, as you see here. See?